Today we're going to cover bubble CPAP for low-income countries with only oxygen source. It's a setup that's reproducible and at a low cost. And you can use also a concentrator to deliver the CPAP to the baby. First thing we're going to cover is you have a list of supplies. A list of supplies is you have to have an oxygen source. This is an oxygen flow meter and or known as a gauge in some places. You need a humidifier, and the humidifier needs to be now at the low level when you put water in this. And I have a green only for coloration so that you can see where it needs to be set. Okay? You need to have a nasal cannula that's in one piece, and it also has what I call a lasso to it. So this would secure it around the baby's head. And the next we're going to do is we're going to have a bottle of water that it goes to that is now going to deliver our CPAP to the baby. So our first step is to make sure that we have the humidifier with the correct level of water. Then we'll take the cannula that's already in one piece. We're going to cut it only one link of the cannula and make sure that the lasso stays on, because this will now go around the baby's head and secure it. So we have now oxygen coming through this tubing. So if we don't put a knot in one end of this, what happens is we lose the oxygen. The other end is attached to a piece of IV tubing like this. You have the nasal cannula with your lasso, with your knot at this end, and this section goes to IV tubing. And then it's now attached to a bottle that's going to produce the CPAP. And what you need to do for the top of the bottle is that on the cap is put two holes in. You can now put the holes in with anything you want. One is going to be a vent hole. The other hole is going to now hold the part of the IV tubing, as some places call it a giving set. And this will go into the bottle. And we will review all these steps again because this is really simplified. And you want to make sure when you put the IV tubing in, that it's going to be in secure, that it's not going to slip out, because this is what's going to select your level of CPAP. So I've got markings on here, and there's a fill line right here again that's colored water so that you can visualize that the water is in the bottle. Okay, you have a fill line, and that's where your water needs to be maintained to keep your CPAP. And another 1.5 inches down from that, you'll create now 3 centimeters of water pressure. Then every inch thereafter, you'll create now 2 centimeters added to the 3 makes it 5. And then 5 plus 2 makes it 7. 7 plus 2 makes it 9. So you can have whatever level CPAP that you need. So as we take this and set it up on the baby, and this would be attached to your source of oxygen, whether it be a concentrator or your flow meter with your humidifier. Okay? So this goes on the babies. As I said, we kept the lasso so that we could put it around the baby's head. We need to tape the nasal cannula to the baby and secure it. There's your knot. There's your IV tubing going to your CPAP. So you can select what level of CPAP that you want to use, depending upon the size of the baby. So again, let's review. What do we need? Supplies needed for bubble CPAP. You need an oxygen gauge This gauge needs to be set at 2.5 to 3 liters of oxygen as long as the baby doesn't have a demand for higher oxygenation. That's going to ensure that you're going to create this bubble CPAP in this bottle. And it has to be with a humidifier, and the humidifier is placed at low level. And the water is kept at the minimum level all the time. And the nasal cannula is the next thing that you need. Okay, and then one limb, remember, one limb of the nasal cannula is cut, and we have a knot in one, and the other end is attached to a piece of IV tubing or whatever tubing will fit on the end of that limb of the nasal cannula. And the bottle has markings on it.
So, quick question from the audience. You said you could do different settings of pressure for the CPAP. How do you do that? Is it based on the water or where the tubing is in the bottle?
It's based on where the tubing is placed in the bottle. Thank you for the question. And the fill line must be kept at this level at all times. If not, then you're not going to be able to maintain your CPAP. So you can use any bottle you want by putting the mark on where the fill line is, and 1.5 inches down, you're going to start with your 3 centimeters of water pressure, and every inch thereafter, you're going to be adding 2 to that number. So if you put another inch past 3 centimeters, you're going to get 5 centimeters of water pressure. This is not exact because we don't have a manometer, but it's getting pretty close to it. And the cap, remember, has 2 holes in it, one to vent and one to secure the tubing so that you can create your CPAP.
Question from the audience. How big is the vent hole?
The vent hole is just putting a pair of scissors or anything that has a sharp end on there and creating the hole. Now what you want to do is you want to check, can your IV tubing go through that hole? If your IV tubing goes through it too quickly and you don't have anything to secure it, it comes out very easily, then what you need to do is you need to make that your vent hole and then go make another hole so that your IV tubing goes through. And so it fits in there snugly. The reason we put the baby on bubble CPAP, we're talking about a newborn, and also your pediatric patients would also qualify for the bubble CPAP. And my last trip to Maua Methodist Hospital in Maua, Kenya, I had 12 babies on bubble CPAP, which were successful. They were all weaned off, and that included 27-week twins, premature. All right. You put them on because if the baby's tachypnic, and that means that they're breathing faster than what they should be. Normal rate of breathing is 40 to 60, and if the baby is breathing faster than that, then you want to put them on a bubble CPAP system. If they have flaring of the nose, or if they're grunting, making noises so that they can now be able to get a breath in, or you have retractions that they're indrawing, as some are referred to, that their chest wall sucks into almost the back of their back, or if they're cyanotic, or their O2 needs increased requirements. So if a baby comes in from the outside and he's not a newborn, and if his saturation level is in the 60s, which it did happen to me 2 years ago, then I brought the baby up within 5 days to a saturation of 96% on room air. It does work. You have premature babies, this is something that really needs to be put on them because their surfactant level is not developed. And this will help open the airways and keep their surfactant developed. And if a baby has pneumonia, pulmonary edema, these are some of the reasons that you would put the baby on the bubble CPAP system. And what you want to do with the bubble CPAP then is you want to check this at least every 4 hours. Or if you're in the room, check the baby frequently. You want to check the humidifier level. Is it on low level? Okay, so you want to make sure that that is checked. Are there bubbles in your bubble CPAP bottle? Now, you can get bubbles in your bubble CPAP bottle and without the nasal cannula being in the baby's. So you want to make sure, is the nasal cannula in the baby's nose? Is the fill line appropriate? Do you have your water fill up to the fill line? Because if not, you're not going to get the CPAP level that you've now designated that you wanted. And is your oxygen gauge? Oh, the baby has 100% oxygen. Let's turn down the oxygen gauge. No, because you need 2.5 to 3 liters to maintain this. And it's not going to hurt the baby, because now what we're doing is we're saving the baby's life. Remember, is the cannula in the baby's nose? Because you can have the bubbles going without it being in the baby's nose. So make sure that your cannula, you have one limb cut, there's a knot in it. The other one goes to the bottle that is a CPAP. And now we're checking what level line. You can use any size bottle you want. You can take and you create your fill line wherever on the bottle, and then 1.5 inches down, you're going to have 3 centimeters of water pressure. An inch after that, you'll have 5 centimeters. An inch after that, you'll have 7. So you can decide what size bottle you would like to use. And also you have to remember that you're going to put 2 holes in this cap. One for the IV tubing, and the other one is a vent hole, so that you can maintain the CPAP.